Well, here we are in the studio, and I'm so pleased to be able to introduce this morning Josanelle Gavino, who is from the Outpatient and Physical Therapy program here at Green Spring. And it's a pleasure to have you with us.
My pleasure. Thank you. Good morning.
Good morning. And I know you have lots of good information for us, so go ahead.
Well, my topic for today is how we can age in place, and what we looked at in physical therapy as well as occupational therapy is looking at the environment of our residents and see how they can live safely in their own environment and make recommendations and changes that would help them stay longer and age in the place that they're living at. So I have with me some helpful things that might be useful for them to keep them safe in their environment. One of the things that we looked at is really looking any clutter in their apartment, rugs that can cause them to slip, a lot of furniture that would not allow them to move around in their environment are something that we looked at. Keeping those clutters aware is the first and foremost thing that is really important, because a lot of times we forget to see what's out in our environment if there's so many things around us. Especially if we use a cane, a walker, then we need more room to move around. For people who use power chairs or rollators, those are the ones that has 4 wheels and a seat in the middle. So it's important that we keep our area free, that we can move around safely. The other things that we looked at are things that they might need to help them move from one point to the other, like say, for example, in the bathroom, how they safely get up from the commode, how do they get in and out of the shower, installing grab bars when needed, like putting it out on the side where they can hang on to it and step over and take a shower safely in and out. There might be a need for them to have a seat, a shower seat, because standing now might be too taxing for the residents. So we look into whether or not it's appropriate for them to have a shower chair. In the commode itself, if it's hard for them to push up, we can recommend maybe having a raised toilet seat that would help them push up from the chair. Also, a common thing that we see in the bathroom is that there are a lot of other things in the bathroom that need to be there. Say, for example, I've visited one resident who has a little curio in the bathroom where a lot of things are stacked up. So there's no way that a walker would fit in, but just just get in and out. So things that are really not needed needs to be out of that place and maybe store it in another area.
Or you may not need them at all.
Oh, exactly. Sometimes we try to hold on to things that really we don't need anymore. So those are the things that would be helpful in the bathroom area. In the bedroom area, really what I can think of that's really important is lighting. A lot of residents go to the bathroom middle of the night and get up and go to the bathroom. So keeping a light on, even those plugged-ons would be night lights would be helpful for them. I've seen that also. One that's useful is a clap-on, or something that you can touch the lamp, so it's easier for you to just get access to the light on rather than standing up and switching the light, because sometimes it's across the room. So those are useful as well. Putting your walker close to you, so that way another step or two to get the walker is not safe, especially at night if you're getting up. So putting the walker close to you, making sure if it's a rollator that it's locked, and not just automatically assume that it's locked, making sure that it's locked before you stand and get up to the bathroom. So those are things that are in the bathroom area that, in the bedroom area that would be useful for the residents.
Well, it's very interesting to hear you say all those things, and aging in place. I remember when I first came here, which is now a long time ago, I I heard the term aging in place, I thought, yeah, I guess we're all doing that no matter what age we are actually.
Right, right, right.
But,
And you can still, you know, stay with some accommodations. I know a lot of residents are hesitant to have anything added on to what they're able to do. They want to stay independent, but truly they can be independent and safe. Just knowing how to adapt to their environment. You know, their vision may not be as good and clear as before, and they might have to accommodate with that by providing more lighting or some lighting that is accessible, like fluorescent light that is more of a stand lamp, things like that. That might be helpful for them. You know, simple things that makes a difference in them, for them to stay where they are.
well, your name is Josa Nell, but you said I should call you Nell.
Oh yeah, they call me Nell.
Okay, Nell. How do you decide when it's time to go into someone's apartment and make those kind of suggestions or helpful things?
There's a couple of things. One is if I work also in the inpatient rehab section, the Garden Ridge area. So most of the residents we see there are coming from the hospital, and we do rehabilitation until they're ready to go back to their apartment. And so when we see them over at Garden Ridge, then we make recommendations that maybe we should take a look at your apartment and see how you are performing in your own environment. So that's one way of we can do a home assessment. Another way is in outpatient rehab department, which I also work off and on, where residents come in and you know, we recommend that maybe they would benefit for a home assessment, especially if there are high fall risk. We recommend that maybe a therapist would take a look at the apartment. And another one is anybody can come to make you know, just ask for a referral.
Or request
For an
that service.
home assessment. Yep, definitely, definitely. It's always useful, and a skilled.
Do some people
person would do
resist having that happen? Well, I'm sure that happens.
Yeah, that happens. Yeah, you know, sometimes it's a privacy issue that they don't want anybody looking into what they can do. Some are afraid that we might say something that may not be to what they want to do, but really, they have to understand that it is to their benefit.
Yes.
To their benefit, and
You're
sometimes
trying to keep us safe.
right, to age in place, you know,
In a safe way.
in a safe way,
Right.
right.
How long have you been here at Green Spring?
I have been here for 12 years now.
Really?
Yes.
That's interesting
yeah.
because I've been here almost 15 and I don't think I've ever seen you before.
Probably you were at you haven't been to Garden Ridge, or maybe to visit. Maybe just
I've
to
been
visit.
to visit, but
Not to-
actually there as a patient.
As a
so
patient.
I'm very lucky.
Yeah. Yes.
But I know it's so reassuring to us to know that we have all of those wonderful therapy services plus everything else that happens at Green Spring to help us age in place in a healthy way. And
Right. And sometimes really just looking at what they can do to help them walk better is, you know, is something that would be helpful for them. You know, if they can't make it to the dining room now, is it becoming harder? We can take a look at that as well and see how we can help them still be able to walk to the dining room and back, or even use a power chair. You've probably seen some of the residents that use power chair.
many of them.
Yeah.
Since I've come here, that
Right.
sort of mobility devices have increased enormously.
Yeah. So it's also good for us to check it whether or not you're safe to use it.
Well, I always wonder, does a doctor prescribe that, or do people sometimes just choose to have?
Unfortunately, sometimes people just get it, and you know, really, they should be checked to be safe.
Yeah,
on
I
how
would
to
think that there
and
should
be taught on how to use it.
Yes.
You know,
And,
it's easy to operate, but then sometimes, you know, not knowing safety things. It's like learning how to drive in the community.
Even the walkers and the rollators
Right.
have to be sort of adjusted to your physical
Exactly. Yeah. If you see some people that are leaning over,
Way
stooping
over.
over when they're walking, then maybe they can be, checked by the therapist and see how they can use it better.
Well, it's so interesting and so helpful to give us that kind of information because, all of us know that at some point we may need that kind of help, and it's so reassuring to know that you're here and doing that.
Thank you. Thank you.
The time has gone so quickly. We have a few minutes left. Do you have something else that you want to add that's really very urgent and important?
Well, it's a pleasure to be here, and I just want to say thank you for inviting Rehab to, give some information about being safe in their environment. I think it's a useful thing to have us here to just kind of communicate what we can offer for you and not be afraid or be intimidated, but what we can do in terms of suggesting how you can age in place safely.
Does a doctor normally recommend that people use your services, or like if, for instance, if I thought I think I need therapy, could I just go?
Well, the good thing about it is we are a community, so we have the medical center to go to. We do need a prescription for us to see you. So yes, and the doctor, we have a very good rapport at the medical center.
Yes.
So if there's anything that you need, yes, you just go to them and then request for a therapy evaluation, and would be happy to schedule you in rehab anytime.
Well, I think our time is already gone, Nell, and it was just very interesting and very informative to have you with us this morning, and I'm happy to meet you because I had not met you before.
Thank you very much.
So I know you have many tasks to go back to. So have a good day, and
Thank you.
We'll look for the next update.
Thank you.